When you think of diabetes symptoms, you probably remember three: excessive thirst, frequent urination, and weight loss. And you're right. These are classic symptoms that have been recognized since ancient Egypt, over 1,500 years before Christ. However, diabetes can present many other signs that many people aren't aware of. In this video, I'll be talking about the top 10 symptoms of diabetes. The earlier we identify them, the better the chances we have to avoid its complications. Early diagnosis. Why is it so important? Discovering diabetes or prediabetes early on is crucial. It allows us to take measures to avoid severe complications and, in the case of prediabetes, we can even prevent the person from developing the disease. At the end of this video, I'll be sharing how to prevent diabetes with lifestyle changes, so stay tuned. But before we start, don't forget to give this video a thumbs up. Let's try to make this video the most liked on the channel. Do you think we can reach 100,000 likes? With your help, I'm sure we can. Also, share this video with your friends and family, as diabetes is a very common condition. In the UK, over 4 million people have been diagnosed with diabetes, and it's estimated that around 850,000 more people are living with the condition undiagnosed. That's why this video is so important. Types of diabetes. Understanding the differences. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes. Type 1 diabetes is an autoimmune disease. This means that the body's own immune system attacks the beta cells in the pancreas, which are responsible for producing insulin. As a result, insulin production stops or becomes very low, and the person needs external insulin to survive. It's more common in children and adolescents, especially between the ages of 10 and 14. Symptoms usually appear suddenly and intensely, such as extreme hunger, excessive thirst, rapid weight loss, and frequent urination. Type 2 diabetes. Type 2 diabetes, the most common type, is mainly related to insulin resistance. In this case, the body's cells do not respond properly to insulin, leading to elevated blood sugar levels. It's more common in adults, but due to the increasing prevalence of childhood obesity, it's becoming more frequent in children and teenagers as well. Abdominal obesity is the main risk factor for developing type 2 diabetes. Obesity and diabetes, an important warning. When talking about obesity, it's important to distinguish between different types. The apple-shaped obesity, where excess fat is located in the abdomen, arms, and neck, is strongly associated with insulin resistance and the development of type 2 diabetes. On the other hand, pear-shaped obesity, where fat is deposited in the thighs and hips, has a lesser negative impact. Additionally, physical exercise is a powerful ally. We see this in sumo wrestlers, who, despite consuming a diet of 7,000 calories a day and being obese, rarely develop diabetes due to their high levels of physical activity. Genetic component. Is there a predisposition? Yes, particularly for type 2 diabetes. Studies with identical twins show that if one twin develops diabetes after the age of 40, the other has a 70% chance of developing the condition within a year. This demonstrates that genetics play an important role, but it's not the only factor. Lifestyle is crucial. Main symptoms of type 1 diabetes. Rapid weight loss. Despite eating more, the person loses weight quickly. Extreme hunger. The hunger is constant because the cells cannot get enough glucose. Excessive thirst and urination. The body tries to eliminate the excess glucose through urine, leading to intense thirst. Blurred vision. Increased glucose levels can change the shape of the eye's lens, affecting vision. Diabetic ketoacidosis, a severe complication that can be life-threatening. Symptoms include abdominal pain, nausea, vomiting, rapid breathing, and breath that smells like rotten apples. Main symptoms of type 2 diabetes. Dark patches of skin, known as acanthosis nigricans, these appear in the folds of the neck, armpits, and groin, indicating insulin resistance. Periodontitis, chronic gum inflammation common in diabetics, increasing the risk of heart and kidney complications. Fungal infections, High blood sugar feeds fungi, causing infections in warm, moist areas such as the mouth and genitals. Blurred vision. High blood sugar levels can cause temporary blurred vision and, in the long term, diabetic retinopathy. Burning feet. Diabetic neuropathy affects up to half of diabetics, causing burning and pain in the feet, and can also damage other organs. Fatigue. Lack of energy in cells, coupled with anxiety and poor sleep quality, can lead to extreme tiredness. Excessive hunger. Constant hunger, especially for sweet foods, is a sign that cells are not getting enough glucose. Excessive thirst. The kidneys try to eliminate the excess sugar through urine, increasing the need for liquids. Unexplained weight loss. Without enough insulin, the body uses fat and muscle for energy. Frequent urination. Increased urine production as the kidneys work to eliminate excess sugar, creating a vicious cycle of thirst and urination. How to diagnose diabetes? There are 3 main tests for diagnosis. Fasting blood glucose. Normal levels are up to 5.5 millimoles per liter. Between 5.6 to 6.9 millimoles per liter indicates prediabetes. From 7.0 millimoles per liter onwards, it indicates diabetes. Oral glucose tolerance test. Normal is up to 7.8 millimoles per liter. Between 7.8 to 11.1 millimoles per liter indicates prediabetes. Above 11.1 millimoles per liter is diabetes. HbA1c measures the average blood glucose over the past 3 months. Below 5.7% is normal. Between 5.7% and 6.4% indicates prediabetes. Above 6.5% indicates diabetes. How to prevent the progression from prediabetes to diabetes? The Diabetes Prevention Program, DPP, study showed that lifestyle changes, such as weight loss and regular exercise, can reduce the risk of developing diabetes by up to 58%. The medication metformin also proved effective, reducing the risk by 31%. With the right knowledge and lifestyle changes, it's possible to prevent and control diabetes. If you identify with any of the symptoms mentioned, consult your doctor and have the necessary tests done. Taking care of your health is essential. Did you find this video helpful? Now you know how to recognize the symptoms of diabetes and what to do to prevent the disease. Leave a comment if you or someone you know lives with diabetes and how you manage it. And don't forget to check out our other recommended videos. See you next time.